Have you ever experienced headaches that are persistent and don't feel like just another regular headache? Or those chills that make you shudder? It's easy to dismiss these as merely symptoms of a bad day, but did you know they could indicate something more serious? In this video, we'll unravel the mysteries of fungal meningitis, exploring what it is, its symptoms, how it's diagnosed, and the available treatments. This information could be vital for you or a loved one, so stick around because you don't want to miss this life-saving information. Let's dive in. To understand fungal meningitis, let's first visit the control center of our bodies, our central nervous system. It's made up of the brain and spinal cord. As the VIPs of the party that is your body, they're encased in a protective layer called the meninges. Think of it as their personal security detail. The meninges protect these vital organs from damage and infection. Now let's introduce the villain of our story, the fungus. Most fungi are harmless and many are even beneficial. But there's a select few that can wreak havoc when they enter the body and reach the central nervous system. This can lead to inflammation of the meninges, a condition we call meningitis. When the culprit is a fungus, we're dealing with fungal meningitis. But where does this fungus come from? It's all around us, in the soil, in the air, even in bird droppings. Usually our immune system can handle these microscopic invaders, but sometimes, especially when the immune system is weakened or compromised, the fungus can take hold and cause serious illness. You may be wondering just how common this condition is. Fungal meningitis is rare, especially compared to bacterial or viral meningitis. However, when it does occur, it can be very serious and require immediate medical attention. That's why it's important to be informed about this potential threat. Let's delve deeper into the symptoms. You know, the body's SOS signals. Symptoms of fungal meningitis might not be as straightforward as you'd imagine. They're not like flashing neon signs, but more like a creeping fog that intensifies over weeks, even months. Starting with milder symptoms, you may first experience fever and headaches. But these aren't just your regular headaches. They can be persistent and get worse with time, not the type that would go away with a cup of tea or a good night's sleep. Additionally, you may experience a stiff neck. You'd notice your neck becoming more resistant to bending, and it could even hurt to lower your chin towards your chest. Now, let's talk about the symptoms that are cause for immediate concern. Imagine experiencing sensitivity to light or photophobia. It's like the world suddenly becomes too bright, and your eyes hurt from light that never bothered you before. This is a red flag that warrants immediate attention. And then there's confusion or difficulty concentrating. Suddenly, you might find it hard to keep up with conversations, forget things, or even feel disoriented. We're not talking about misplacing keys, it's a more substantial shift in mental state. Lastly, in severe cases, fungal meningitis can lead to seizures. This might be the body's final, desperate SOS, signaling a critical situation that needs immediate medical intervention. Seizures can be very scary, presenting as uncontrollable shaking, and might even cause the person to lose consciousness. Any combination of these symptoms, especially in people with weakened immune systems, should prompt immediate medical attention. It's always better to err on the side of caution when dealing with potential fungal meningitis. Hey, if you are getting value, please like and subscribe. Moving on. Let's dig a bit deeper into how one can become affected by fungal meningitis. This condition is not spread from person to person, but rather from inhaling fungal spores. But where do these spores come from? Many fungi that can lead to meningitis, like the Cryptococcus species, can be found in soil and bird droppings around the world. In contrast, histoplasma is primarily located in bird or bat droppings in the Midwest United States. So in essence, something as simple as gardening without a mask in these regions could potentially expose you to these fungi. Now you might wonder, why doesn't everyone who gardens or lives in these regions get infected? Here's where risk factors come into play. A healthy immune system can often prevent these fungi from causing meningitis. However, if your immune system is compromised due to conditions like HIV/AIDS or the use of medications such as corticosteroids or TNF inhibitors, you're more likely to become infected. Moreover, individuals who have undergone organ transplants are also at a higher risk. This is because they have to take certain drugs to prevent their immune system from rejecting the new organ, which, unfortunately, also makes them more susceptible to infections. Similarly, those who are undergoing chemotherapy for cancer or have chronic diseases like diabetes are also more vulnerable. Lastly, let's not forget our lifestyle choices. Smoking, heavy alcohol consumption, and poor nutrition can also weaken your immune system, thereby increasing your susceptibility. Age plays a role too, with the elderly being more prone due to a naturally weaker immune system. As with many health conditions, prevention often starts with maintaining a healthy lifestyle. Now let's talk about diagnosis. It is a critical part of the journey in any health condition, and it's no different for fungal meningitis. It's a somewhat complex process due to the nature of the disease. To start with, your doctor will likely ask about your medical history. They'll want to know about any recent exposure to areas known for certain types of fungi, like bird or bat droppings. These seemingly ordinary details can be the first key to unlocking the mystery of your symptoms. Here's a trivia question. Can you guess what's the gold standard for diagnosing fungal meningitis? The answer is lumbar puncture, more commonly known as a spinal tap. This procedure involves collecting cerebrospinal fluid, or CSF, the fluid that bathes your brain and spinal cord. This sample is then sent to a lab where it's carefully analyzed for signs of inflammation and tested to identify the specific fungus involved. But the detective work doesn't stop there. You see, diagnosing fungal meningitis is not always straightforward. The fungal organisms involved can be slow growers, which may delay confirmation of the diagnosis. In some cases, your healthcare provider might use imaging tests like CT or MRI scans. These tests can provide images of your brain and help identify changes like swelling or abscesses that could be indicative of fungal meningitis. Once a diagnosis of fungal meningitis is confirmed, your doctor may run additional tests to identify the type of fungus involved. This is critical because treatment can vary depending on the specific fungus. Cryptococcal meningitis, for example, is typically treated with specific antifungal medications like amphotericin B and flucloxetine. This tailored approach ensures that you get the most effective treatment for your condition. Fungal meningitis, like any uninvited guest, requires tact and patience to handle. The primary mode of eviction is through antifungal medications. However, the type of medication, dose, and duration all depend on the specific fungus causing the infection, as well as the patient's overall health. The treatment begins with administering antifungal drugs intravenously, which means they're given directly into a vein. The initial phase of the treatment, often referred to as the induction phase, involves a strong, aggressive dose of antifungal agents to get the infection under control. Once the infection has been controlled, which is typically determined through clinical evaluation and lab testing, we move on to the consolidation phase. This phase involves a continuation of antifungal therapy with a medication called fluconazole and may last for a minimum of 8 weeks. This step is crucial to ensure that the fungus has been entirely eradicated and to prevent a potential relapse. Unfortunately, the battle might not end here for some. Long-term suppressive treatment or maintenance therapy may be required for individuals with persistent immunosuppression. Fluconazole is commonly used in this phase as well. It's important to remember that each patient's case is unique, and the treatment approach may vary accordingly. Close follow-up with healthcare providers is imperative to monitor potential side effects of these medications and the patient's overall progress. Remember, when it comes to fungal meningitis, persistence and patience are your greatest allies in combating this microscopic intruder. Let's talk prevention for a moment. It's that proactive measure we take to keep our body's defense system robust, to keep the unwanted guests out. It becomes particularly crucial when we're talking about something as impactful as fungal meningitis. Now, the first line of defense against fungal meningitis is maintaining a strong immune system. You might ask, how exactly do we achieve that? A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can nourish your body with essential nutrients. Regular exercise, adequate sleep, and stress management techniques like yoga or meditation can also bolster your body's defenses. Living in areas known for certain fungi or exposure to bird or bat droppings can put you at risk. If you have a weakened immune system due to an underlying condition or treatment, consider wearing a mask in these environments. It's an added layer of security you need. Finally, if you're on long-term medications that weaken your immune system, regular checkups with your healthcare provider are critical. This allows for early detection and treatment of any infections. Vaccinations are another crucial preventive measure. While there's no vaccine for fungal meningitis as of now, getting vaccinated against other forms of meningitis can protect you from those strains. These preventive measures, while seemingly simple, can make a world of difference. They not only help keep fungal meningitis at bay, but contribute to your overall health and well-being. Before we conclude, it's important to grasp the scale and impact of this disease. In the world of diseases, fungal meningitis is considered quite rare. According to the Centers for Disease Control and Prevention, less than 1,000 cases are reported annually in the US. However, it's crucial to remember that numbers aren't the whole story. Though the incidence is low, the severity of fungal meningitis can be life-altering or even life-threatening. It's a sobering thought that adds weight to our journey. The mortality rate of fungal meningitis can range from 20% to 30% even with treatment. That means for every 5 people diagnosed, 1 might not survive, underscoring the seriousness of this condition. A study in sub-Saharan Africa revealed that around 15% of HIV-related deaths are due to cryptococcal meningitis. Though it may feel like we're wading through heavy terrain, it's vital to confront these realities. Understanding is the first step in prevention, after all. Remember, awareness is our first line of defense. By learning about this, you've already taken a crucial step towards safeguarding your health and the health of your loved ones. But why stop here? There's an entire universe of health knowledge waiting to be discovered. Click on one of our other enlightening videos and continue your journey. Thank you for watching, and we will see you in the next video.